Good afternoon, friends. I'm Dr. Aajay Shah, and I'm bringing you this another Facebook Live. This is our afternoon live. I've been doing this afternoon live during my lunch break. Have a quick healthy lunch, and whatever time I save, I go ahead and have one small live. We are on Facebook 6 months now. We have crossed actually 25,000 follower mark, which is a great achievement, great feeling. So please invite your friends and family to join our movement. We are also on YouTube, so reach out to our YouTube videos also. So we will continue today with nutrition tips or healthy eating tips. Again, our Facebook page is Healthy Living with Dr. Aajay Shah. So invite your friends, and our YouTube channel is Healthy Living with Dr. Aajay Shah. So subscribe to that channel. So today we're going to talk about nutrition. Today's topic is role of omega-6 and omega-3 fatty acids. So omega-6 and omega-3 fatty acids both are essential fatty acids. They both are polyunsaturated fatty acids. Essential means our body does not make them, and we need to take them from outside, from either plant-based source or animal-based source. So again, both omega-6 and omega-3 are essential amino acids. Omega-6 we typically get from vegetable oil, like soy oil, sunflower oil, cottonseed oil. Almost all oils have omega-6, but these oils, three oils, soy oil, sunflower oil have maximum omega-6. Some of the meat products also can give omega-6. Some seeds and nuts also can give you omega-6. Omega-3 typically come from fish, particularly fatty fish, from flax seeds and chia seeds and other seeds, and also comes from nuts. So again, omega-6 and omega-3 both come from plant-based source and animal-based source. The reason we worry about omega-6 is a pro-inflammatory. People who have large amount of omega-6 in their diet, they have chronic inflammation. And as you all know, chronic inflammation can lead to many diseases, including heart disease, diabetes, Alzheimer's disease, cancer, and many other chronic diseases, including living less. So definitely chronic inflammation is not a healthy thing to have, and omega-6 can have chronic inflammation because they are pro-inflammatory. Omega-3, on the other hand, are anti-inflammatory, and that's the reason people who have high omega-3 diet, they live long, and they also have a less chance of chronic inflammation. So again, both are essential. We need both omega-6 and omega-3. The function of omega-6 is to help with acute inflammation like injury. So again, we need omega-6. We need omega-6 because it helps immune function, it helps with acute injury or acute inflammation. But it's the ratio of omega-6 to omega-3 which is very important. So again, ratio of omega-6 to omega-3. The typical ratio should be below 5 to 1. Below 5 to 1 omega-6 to omega-3. Matter of fact, the ratio about 200 years ago was 1 to 1. That means we were having equal amount of omega-6 and omega-3. And it was a very healthy situation. The ratio in American people, the ratio is anywhere from 15 to 20, and some people have ratio as high to 1. So a lot of people do extreme amount of high level of eating of omega-6. Indian people cook with a lot of vegetable oil, have very high amount of omega-6 in their diet, and that's the reason many Indians develop premature heart disease, including dying in young age from heart attack, diabetes. A lot of Indians have diabetes, a lot of stroke, a lot of Alzheimer's disease, and obviously dying young. So again, omega-6 is definitely should be avoided. That means vegetable oil should be avoided. You can check your omega-6 to omega-3 ratio with a simple blood test. It costs about $40 or $50. It's easily available. I had my ratio checked. My ratio is about 5 to 1. My ratio is pretty fair. So what are the benefits of omega-3, or what are the benefits of low ratio of omega-6 to omega-3? So what are the benefits of omega-3? Omega-3, diet with omega-3 can lower your blood pressure, normalize your blood pressure, can help your cholesterol, can definitely help the heart attack prevention, can prevent the stroke, can actually prevent dementia and Alzheimer's disease. It can also help you sleep better. It can help in depression. It can help in bipolar disorder. It can help with the ADHD. It can help joints. It can definitely help eyes, particularly dry eyes and macular regeneration. It can actually has shown to have benefit in muscle building in bodybuilders. Definitely omega-3 intake in pregnancy is also recommended because it helps to develop the fetal brain. So I recommend to all pregnant women to take adequate amount of omega-3, either by supplement or with the diet. Definitely omega-3 has shown to lower the mortality. Actually, omega-3 also has shown some benefits in fertility also. It also can help to prevent many cancers. It also has shown to have better hair, better nail, and better skin health. So again, omega-3 has a tremendous amount of benefit. You can get omega-3 from animal source or plant-based source. Sources typically include fish oil or krill oil. Fish oil or krill oil. Fish oil is a typical supplement most people take, but in my opinion, krill oil supplement is better. Krill oil actually supplement has more data in terms of better brain function health. The both are available on Amazon. I would not take more than 3 grams of fish oil per day, maximum 3 grams per day, because after that, you are at higher risk of bleeding and your immune function can also go down. So again, no more than 3 grams of fish oil per day. Sometimes I prescribe up to 6 grams of fish oil for high triglycerides. I stopped doing that. Most of my patients who go vegan or who go plant-based, whole food plant-based, their triglycerides starts coming down. So typically, triglyceride lowering effect of fish is not necessary if you go whole food plant-based. At the same time, there are prescription fish oil available to lower triglycerides. So check with your doctor whether you need to take prescription fish oil tablets to lower the triglyceride. But I think in general, I like to avoid high dose of fish oil because of bleeding issue and immune function issue. You can lower your triglyceride by going whole food plant-based diet. Best way to take omega-3 is by source or plant-based source, which is an algae-based source. You can get algae-based omega-3 on Amazon. Cost is same as fish oil. I typically take algae-based omega-3 now. I don't take any fish oil. You can also get omega-3 from flax seeds, chia seeds, even walnuts. So taking 2 tablespoons of flaxseed every day gives you enough omega-3. So everybody should be taking 2 tablespoons of flaxseed every day. You can take flaxseed just by itself if you don't mind the taste and the consistency, or you can put flaxseed on your oatmeal or in your meal or in your smoothies. We always have flax meat in our smoothies. You can also take chia seeds. So those are the plant-based source of omega-3. The best thing is to have low omega-6 in your diet, so your ratio will be always better. That means not using any vegetable oil as much as avoiding any products which has a high omega-6. Typically, we need about 1.6 to 2 grams of omega-3 as a dose. 17 grams of omega-6. Definitely, we should avoid more than that per day. The way our body works, we take plant-based ALA, which is essentially a fatty acid. So we get that from plant, and then our body converts ALA into EPA and DHA. But this conversion is very inefficient and some people. So again, ALA to EPA and DHA conversion is inefficient in some people, and for that reason we need to take DHA and EPA supplement. So conversion rate is sometimes low in people who take high omega-6 because it's the same enzyme which converting to omega-6 versus omega-3. So people who eat high omega-6, they also have a conversion from ALA to DHA, EPA in a less amount. So that reason you should avoid omega-6 also. Other thing is obese people, people with diabetes, people with high blood pressure also have a less conversion from ALA to DHA to EPA. So if you have any of that condition, you should definitely consider taking omega-3. Again, omega-3 supplements, in my opinion, are recommended by most health experts. I recommend omega-3 supplement myself. I take everyday omega-3 supplement in the form of flaxseed. I probably take 5-6 days a week. Sometimes I forget, but I try to remember flaxseed every day. definitely avoid omega-6 as much as possible. You omega-6, but not in a high amount. Avoid vegetable oils as much as possible. I hope you like this video. This was just a short video, about 10 minutes long. This will be on YouTube in a few hours. It will be under omega-3 and omega-6 nutrition tips. Again, if you like what we do, invite your friends and family to like our page. You can just do it by simply go to invite, go to like pages, and then go to invite, and then select all the friends you want to select. I think there is sometimes a function called select all, and you can invite all, or you can select 25 people at a time and invite to our page. Also, go ahead and reach out to our YouTube channel, Healthy Living with Dr. Aajay Shah. That channel and watch the other videos on that channel. So again, this was a conclusion of omega-6 and omega-3. I hope you learned something. I hope you enjoyed it. Please share if you can. Thank you.